All right, guys. It is 5:30, and you know how I am about time. So let's get started. Welcome. Okay, I see the numbers are still growing. Awesome. I didn't know how many of y'all would be too cold to press um, on the screen. All right, to join me today. All right, you should be able to see my presentation. So please raise your hand if you're able to do so. And if that, all right, I see hands going up. So we are ready. So this is a month where I'm not doing the intakes. So I haven't had a chance to meet some of you, but don't worry, we're going to have visits together coming up. But I want to welcome you to the Practice and Pregnancy Orientation. I'm your host, Dr. Adams, founder of Full Circle Women's Care, and I am excited to meet with each and every one of you in the future. All right, giving you a moment to grab your notebooks, get your pens together, get your questions ready because we have a lot of stuff to cover. Couple housekeeping items first. This is confidential, so you can raise your hand, you can ask questions. I will answer them as they come in. I will answer them in such a way that I won't tell other people who you are. If I think it's a question that's too personal or too involved for this forum, I'll say, hang on to that until your visit and you can ask us in person so that we don't slip up and tell anybody else who's on the line. So please participate. There may be some questions that you asked that I say I'm actually going to get to that a little bit later, and then I may go back and answer your question later on, but feel free to ask it when you're ready. And if you have to hop off at any point, I understand we are going to run into dinner time for some of you. My family's a bit more European in our dining times. We eat later, but all this will be available on a YouTube channel for the duration of your pregnancy. So here's an example of our poll questions. I will say it's time for a poll question. And then you're going to see a question pop up like this. I'm going to ask who's on the call. You'll have a moment to answer there on your phone. So I would like to know how many first-time moms I have on the call and how many mommy veterans I have on the call. And I'll talk a little bit like this, and then I will say the polls are closing, and I will end the poll, and then I will share the results. And today we have more first-time moms than we have mommy veterans. So you answering these questions kind of helps me tailor how I do the conversation as well. So please keep answering. So things we're going to go over today will include the full circle experience, including where we deliver. We'll go through some of our office protocols, how best to engage us, pregnancy visits, prenatal resources, lots of prenatal resources. We will go over exercise and nutrition in depth in pregnancy and wrap up with a quick COVID-19 update. So first, the philosophy of our practice. We are a collaborative midwifery model practice. Midwifery is based on the concept that pregnancy and birth are normal life processes, not some disease you've contracted that we have to cure you of. And so in that traditional midwifery model, they were able to care for normal low-risk women, but if an abnormality in the pregnancy or complication was identified, they would have to transfer out in order to access a different acuity of care. In the collaborative model, you're still able to stay in the care of the midwife for your physiologic part of labor with physician direction for the abnormality or complication. So to that end, most of our labors and deliveries are attended by our certified nurse midwives. So some of you started out as our GYN patients with me, Dr. Merrill, Dr. Mooney, and you're saying, oh, okay, well, let me just slide over here and have one of the docs deliver my baby also. Sometimes that does happen, but the majority of the time, the labors and deliveries are attended by the labor and delivery experts. Now, if there is something that falls outside of the scope of the midwives, like some complication with your labor, say your baby just decides, I don't really want to come out this way, they will call one of the physicians. So if it is something urgent, meaning cannot wait until morning, cannot be scheduled, but your baby makes this decision at 3 a.m., they'll call one of us, either myself, Dr. Mayer, Dr. Mooney, whoever's backing them up, and we will come in. If there is something emergent, as in it cannot wait the 15 or 20 minutes it takes one of us to get into the hospital, then where we deliver, there are OB hospitalists, board certified OBGYNs who are in-house 24 hours a day for true emergencies. To put in perspective, we update our stats. 2023, we did almost 550 deliveries. Only 3 times did we need hospitalist involvement. And to be clear, hospitalist involvement is not always emergency, something bad is happening. The most common times we need the hospitalist is if you come to the hospital and you're 10 centimeters and you make it there before we do, and the hospitalists have to attend your birth. We don't want that to happen. So please let us know when you're headed into the hospital. We'll talk about that in a moment. So, where are these hospitalists? Where are these magical people? Great question. They are at HCA Florida Memorial Hospital. HCA Florida, formerly known as Memorial, a couple of years ago, was taken over by HCA, and it is less than 10 minutes from the office. If you are curious, want to see what it looks like, they do tours. So you are welcome to do one of their grand tours. They do store tours quarterly. I don't think we have the schedule yet for the next tour, but it's a really cool event. They have it's like a baby shower. They auction off cute little presents. Doulas come and set up tables there and give away stuff too. But they also do one-on-one tours. So if the schedule comes out and you can't make it to one of the 4 dates that are on there, you can call a number and you can arrange to have a tour. They do them on the weekends, they do them in the evenings. They're very accommodating so you can see the space where you're going to meet your little one or little ones. With regard to the office, we are open Monday through Thursday from 9 to 1. We then close for 1 hour from 1 to 2, and we reopen from 2 to 5. So if you call the office between 1 and 2, you will hear the voicemail say, "You've reached the after hours line." The line is not broken. Don't worry. It is connected. The after hours line is connected to the emergency on-call provider. So if you have a medical emergency between 1 and 2, you'll still be able to reach someone with your emergency. However, please do not leave a voicemail if it is not an emergency, if it's something administrative. Oh, I think I'm going to be late for my 2 o'clock. I need to check on my whatever you would normally call the office for. Please don't leave that voicemail on the emergency on-call person, as she does not communicate with the front desk after 2 p.m. She goes back to taking care of emergencies. We are open on Fridays from 9 a.m. to 1 p.m. So if you are calling with something administrative at 12:50 on a Friday, then we may not be able to respond until Monday when the office reopens, or Tuesday. Monday is a holiday. We do not do walk-in appointments because our goal is to see you at as close to your appointment time as possible. And if we have promised you the 12:30 spot and somebody walks in at 12:25 and says, "I need to be seen right now," that's not fair to you because you've taken time off of work or arranged sitters or what have you to come across town. And so we will see you at your appointment time, and we ask that you have the same respect for other people who have placed themselves on our schedules at specific times. To that end, we do have limited same day appointments. Sometimes the whole schedule isn't full. So if you're calling in the morning and you say, "Actually, I need to come in and be seen for this thing," we might look at the schedule and say, "You know what? Actually have an open spot at 11 o'clock. We'll go ahead and slide you in that spot." If that time doesn't work for you, or if there's something more urgent, like say you're calling at 10 a.m. and our next open spot isn't until 4 p.m., and we say this isn't something that should wait 6 hours to be evaluated, we might recommend that you go to either an urgent care or labor and delivery. It's not us saying that we don't or won't see you in the office, but it's us saying that we agree this is something that does need to be seen and shouldn't be sitting in our lobby for 6 hours waiting to get worked into a schedule. We are a well office, so we are during RSV, cold, flu, COVID, all the seasons that are going on right now. We do not do primary care upper respiratory infections. All you pregnant people are immunocompromised, and so we don't want anybody in here coughing and breathing those germs all over you. And so again, we refer those out to urgent care. When you call, providers are not able to leave patient appointments to take phone calls. This goes back to the whole "you scheduled this time to talk to me." It would be so rude if I walked into your appointment, ask you how you're doing, and then someone else calls and I'm like, "Hold that thought," and go out and talk to them as if their concerns are more important than yours. You scheduled your appointment time, and so our goal is to see you at that time. If you are calling, though, there are other people here who can take those messages, answer your questions, and respond to you in a timely fashion. But you have to leave a message in order to receive a call back. Sometimes people call and hang up and call and hang up and call and hang up. We will not automatically just call back. You must leave a message and be sure you're leaving it with the right person to get the quickest and most efficient response. So if you're calling with things about, if it's a nurse visit, like you're wondering, is my baby moving enough? Are these contractions? Tony is our nurse who takes those calls, the nurse calls. And it's not an immediate callback if she's on the phone with somebody else. There may be someone else who called right before you, but she will call you back. She also takes care of letters and forms such as FMLA, short-term disability, need to get a break from your gym, for if you're going into preterm labor, not just in general, getting a break from the gym. Many of you have already had contact with our OB clinical coordinator, Naisha. She's the one who sends out your labs. So if you have blood work and that sort of thing, she will send them to you. She also does our referrals. So those of you who need to see a high-risk doctor or cardiologist or hematology or whomever, Naisha coordinates all of those referrals. And if at the end of pregnancy you need something scheduled, like your delivery, C-section version, whatever, or maybe circumcision, Naisha is the one who handles those sort of things. Most of you on the call have already spoken with Renee Hall, our benefits coordinator. She's the one who researched your insurance in order to be able to present you with an estimation of your costs here at the office, not the hospital, but here at the office. So if anything changes about your insurance throughout the pregnancy, Renee Hall is the one who you want to contact for that. After hours, there is always someone on call for our practice from our practice. Remember, she is the emergency on-call person, so she is handling emergencies at the hospital. So this is who you call if you think you need to join her at the hospital. This is not who you call when you say, I completely forgot what Jane told me at my visit today. Can you go through it again with me? That's not what this is for. You also have to leave a voicemail in order to get a call back from her, because the phone doesn't even ring. It doesn't register that anyone is making a call unless a voicemail is left. So pay attention to the prompts on the voicemail so you can leave us the appropriate information so we can look up your chart and respond to you in a timely fashion. The patient portal is another way to reach us, but remember, response times can take up to 2 business days. Business days are Mondays through Friday. And so if you are calling or if you're leaving a portal message on Thursday, then the next business day is Friday, and the next business day is Monday. So I know me personally, Friday is my operating room day, and so if I don't see your message by the time I go into the OR on Friday morning, it will probably sit until Monday. And so if it's a non-action item, like, oh, I was just wondering whether I could take these supplements, that's something that can wait until your next prenatal visit, and we may forward it to the next person who's going to be seeing you in the office, because we're going to be seeing you a lot. So the portal is best used for things that cannot wait until the visit, or like losing your lab slip. Say, one of the midwives printed out your lab slip and you can't find it and you don't want to go to Quest without it because if they say they don't have it, then you just wasted a trip. You need us to email you another copy. That's a good use of the portal. Or if you have some upper respiratory infection and need to cancel your appointment or convert it to a virtual, which is what I prefer. Convert it to a virtual so we can at least talk to you. If there are 2 business days prior to that appointment that's coming up, use the portal. The front desk is very responsive, and they're happy to help you convert that. What we don't want to see on the portal are urgent matters, because again, 2 business days. So please do not send me a message saying my blood pressure is through the roof. I don't feel my baby move. I'm bleeding like crazy. That is not something that should wait 2 business days. Please don't do that to us. Don't do that to yourself. Don't send blitz messages either, because sometimes we get messages saying, I don't know who's on, so I'm sending this message to everybody. Here's a quick tip. No one's on. Nobody is looking at the portal. The portal doesn't come directly to our phones. It's not like texting us. We have to log into the system and be intentional about checking charts and that sort of thing, which is something that we like to do during business hours and maybe for an hour or so after work. But we want to spend time with our families. So multiple messages to one provider and or multiple messages to different providers. At some point, multiple messages will incur a charge, and multiple messages to different providers may get multiple responses. Having someone very upset one time, they went to the pharmacy and there were 5 prescriptions waiting for her. She messaged 5 people and 5 people tried to help her. So send one message. If that person does not respond within 2 business days, then you may pick someone else to send the message and just let them know that you're already communicating with somebody else about it too, so that we're not doing double work. We also ask that you please do not attempt to have an appointment via the portal. If your message starts with, please review these things, and ends with, what are your thoughts? That is a visit. So text yourself questions like that so you can bring them into your visit, and we can go back and forth in depth in real time, and you'll get your answers more succinctly, or schedule an appointment, because we are here doing appointments every day. Other things that are released on the portal are ultrasounds, unless there is something urgently abnormal about your ultrasound. If there's something urgently abnormal, we will not let you leave the building without discussing it. Otherwise, the sonographers have to complete their reports, which we then download from the ultrasound machine and upload into our electronic medical records, distribute amongst the providers, and then send out to you. So say roughly 2 business days in order to review them and put our commentary on it and release it to the portal. Sometimes you're in there, you see Kathleen and Taylor just typing away, and you're wondering, what is on this report? I need to know. And then you send a message, what's on my report? And my response might be frustrating, but it's, I don't know yet. But what I do know is that it's not urgently abnormal because we let you leave the building without stopping you to talk about it. That is the one exception that we have. We will break our day and someone will come and talk to you if there's something that requires an urgent plan for what we saw on ultrasound. Now, Quest also has a portal, but they're kind of annoying with their portal because they'll send the results to you before they send them to me. And then you see that there's something out of range. It's a red number, and red is scary and it freaks you out. And then you upload it to the portal and say, what's all this red mean? But I don't even have the results yet. So please don't do that. Remember, the reference ranges that they use for those labs are for people who are not pregnant. Pregnancy causes some physiologic changes that even if they might appear out of range on your report, they might be fine for pregnancy. So give us a chance to receive the labs from Quest, because if we receive them from you, it doesn't close our order loop, which means nothing to you, but the order loop is everything here. Because if it shows us that we don't have the order loop, we get harassed about, she hasn't done her labs, she hasn't done her labs. So let us receive it from Quest and then review it and release it to you with our commentary. Because again, 9 times out of 10, you're going to see, oh, that's normal for pregnancy. Don't worry about it. The most common reason, though, that we don't have your labs, because sometimes if you've been sitting on the labs for a week and you're like, well, they haven't said anything about it, please let us know that, because sometimes they don't send them to us at all, and we are sitting here waiting on them. But the most common reason that we don't see the labs in your chart is because a different name was used at the facility than you're using at our office. So if you are engaged or recently married and you haven't finished that name change yet, you might be a Smith in your heart, but you're a Johnson to your insurance company. And so wherever you present that insurance card that says Johnson, then you're a Johnson. And if we have you as Smith someplace else, when your labs come in or your documents from a consultant come in, they will not sort electronically into your chart because the demographics don't match up. Alternate name uses guarantees that we are going to have a delay in matching up and reviewing your information. So that's just some basics about interacting here with Full Circle. Any questions about that? And we can get into the fun stuff. All right, cool. Prenatal visits, what to expect at each visit. So text yourself questions, because please expect that you are going to forget every question you said, oh, I'll just ask when I go in for my visit. You're going to hear that baby's heartbeat and you're going to forget every question that you had. We ask you to wear loose, comfortable clothing so that we can access your belly, because we are going to want to listen with our Dopplers to the heartbeat at every visit. Not necessarily do an ultrasound, but take a listen to the heartbeat. We'd like you to get here about 5 minutes before the scheduled appointment time, so you'll have time to check in, resolve any issues with the front desk, and you'll only need to leave a urine sample if it's indicated. So the American College of Obstetricians says we no longer need to check it at every single visit. We'll only be doing it if you have blood pressure issues and we're looking for protein, blood sugar issues like gestational diabetes and we're looking for glucose, or if you had a recent urinary tract infection and we're checking to make sure that everything is cured. Otherwise, we know you are pregnant, you've been drinking your water all day, you just drove over here and you have to go to the bathroom. So please get here early so that you can go to the bathroom before you meet with us. If you're 10 minutes late, we have a 10-minute grace period, so there's still time to check on you and your baby, but it leaves less time for your questions. You're starting a text thread with yourself, and I used to love it when people would come in and I say, do you have any questions? They grab their phone and pull up their text thread. But it leaves less time for us to go through those things after we've gone through all of the lab review and everything else. If you're 20 minutes late, you've missed the entire appointment. There may be one of those open appointments later on in the day. Front desk is actually really good about seeing, oh man, she's going to be 15 minutes late. Let me see if I can work her into this next visit over here. Like she was on Jane's schedule, but I'll work her in with Norma. If you miss the whole appointment, they're trying to figure it out before you get there. So they may be able to work you in later, or they may have to reschedule you to a day or time that works best for everybody. So the other question about appointments is, when do I get another ultrasound, Dr. A? That was so much fun. Diagnostic ultrasound visits are separate from prenatal visits. The providers typically do not do ultrasounds. So the exception is if you just need a fluid check or something like that, one of the physicians may do that in a visit. But if you need a growth ultrasound, or we're following up on any particular thing that one of the techs noted, another one of the techs is going to be doing that next ultrasound. So they are separate from prenatal visits. To know whether you should be expecting to have an ultrasound, take a look at your portal. Is there more than one appointment time? And is there a provider's name associated with your visit? So when Tina Test logs into her portal, Tina is my imaginary patient, she clicks on appointments and she sees that she has 2 appointments on the same day. The first one is at 9:20 with ultrasound, and ultrasound is not a provider's name. The next one is at 10 o'clock with Dr. Yeckel. Dr. Yeckel was a provider, it is a provider's name. And she will have her ultrasound, and then she'll meet with Dr. Yeckel afterwards. So she can tell her family, hey, be here at 9:20 to see the baby. And then afterward, if you want to take off, or you can hang out and talk to Dr. Yeckel as well. Remember, those results will come to you in 2 business days unless there is something urgently abnormal. And in that case, we will not let you leave the building. So if you're seeing one of the midwives or one of the physicians and we say, actually, it's time for you to get an ultrasound scheduled. So when you go up to the front desk, we are sending a message to them telling them what needs to be scheduled. But sometimes y'all are fast, man. Y'all get to that front desk before our message does. Please let them know that you are supposed to be having a diagnostic ultrasound and a prenatal visit when that's due, and do not leave without the 2 appointments scheduled. I have my first question of the day. I'm getting my name changed in May, and my baby is due in August. Would I continue to use my old name for the rest of pregnancy to avoid confusion, or do I start signing under my new name? It's wherever, if you change it with your insurance company, then start using that name consistently here. But if you're changing the name just on your documents, but you haven't changed it with multiple different companies, then just use the same old name, whatever your insurance company has and you're going to be using at the lab. Just keep it consistent, and just let us know if anything does change. You don't have to submit any documents or anything. We'll believe you. All right, boutique ultrasounds. So I've been talking about diagnostic ultrasounds. So these are the ones that, we do for medical reasons. If you just want to look at your baby because you think your baby is cute and you want to look at them some more, go for it. There are places all around town that also just want to look at your baby. So I put a couple on here for informational purposes, not endorsing anyone over another. I know there is one in St. Augustine too, if anybody's in the South and looking at this too. But they do cute little stuff like put the heartbeat in a bear, or just 3D. And a lot of these places will do gender reveal packages starting at 14 or 15 weeks too. So if you don't do genetic screening and you're wondering, well, when will be my first time to find out, you can go to one of these boutique places and they will be happy to tell you whether you're having a boy or a girl. All right, so we are going to do a poll question. Okay. All right, so now that we've talked about ultrasounds, when should you expect routine ultrasounds? I haven't really answered this one yet, but I will in just a moment. Will we be doing them at every visit? I did kind of say that one. Are they at 20, 40, and 41 plus weeks, or do you only get an ultrasound if we think something is wrong? The polls are closing in 3, 2, 1. All right. The answer is at 20, 40, and 41 plus weeks. So 20 weeks is when we do our regular anatomy ultrasound. Unless you have twins, we usually start those maybe 18, 19 weeks. But if everything looks good, we see everything we need on that first ultrasound, and you don't develop any more issues during pregnancy, we do not need to look again until after your due date, which is 40 weeks. All right. Okay, next we are going to move over to the Full Circle website. Okay, so you should be able to see that. Let me know when you're able to see Full Circle Jacks. Raise your hands. All right, I got it. This is FullCircleJacks.com. Some of you were with us and had babies with us when we were at Ascension. We were there for about 9 years, and about a year and a half ago, we moved to the HCA facility. And if you are wondering why we did that, we did a town hall in October of 23 to discuss why. And you can click here and it links to that town hall. You're welcome to watch that as well. All right, so this is fullcirclejacks.com. Everything I go over right now, you will be able to reference after by going to our website. We're going to start with the providers, so who you're going to get to meet. So this is me. You're meeting me now. Hi. This is Dr. Marrow. Some of you did your histories with her. This is Dr. Yeckel. Some of you will meet her on weekends when she covers. And some of you did your histories with Dr. Mooney as well. Then we have the midwives. There's midwife Lauren, midwife Christy, Krista, midwife Cindy, midwife Dawn, and midwife Jane. Some of you have met with Vanessa, who is our PA, who also scrubs into our belly births. And then there's midwife Norma. And we are going to have another surprise midwife coming to hang out with us soon. I'm going to click over here under patient information on the obstetrics tab, and then I will take a couple of questions because they are building up in here. Oh, okay. I am so sorry. Thank you so much. You can't see anything that I'm talking about. Thank you. Let's see. Take two. Okay. Are you seeing it now? Thank you so much. Oh man, you guys missed the beautiful pictures of all of us. All right. So we're good now? Okay. Thank you so much. I'm going to delete all of these. Y'all are awesome. And I was saying, why are so many questions all of a sudden? Because all you could see was Zoom. Okay. Thank you. All right. So there we go again. Me, Dr. Marrow, Dr. Mooney, Dr. Yeckel, midwives Lauren, Krista, Cindy, Dawn, Jane, PA Vanessa, and midwife Norma. Okay, now back to obstetrics. So obstetrics page on our Full Circle website, you'll know you're in the right place when you see all the bellies and finally the baby there at the end. These are our delivery stats. We're very transparent about our numbers because many of you are here because of our numbers. You're either trying for a VBAC and you know we have great success rates, or you're a first-time mom trying to avoid unnecessary C-sections and you know our rates are well below the national average. All right, prenatal care timeline. So we're going to click on this one. And this tells you more in depth what to expect at each visit. So everyone on here has already done their first prenatal visit, which was your confirmation visit. So at the confirmation visit, you have your dating ultrasound and you meet with one of the midwives and they assign what your due date is and you have a urine pregnancy test. Then about 2 weeks later, you meet with one of the physicians virtually to go over your medical history and your pregnancy history. Based on what you tell them about your medical history, they may order additional blood work, but if it's just pregnancy, these are the standard prenatal labs. So again, we have lab transparency here. I have met people who said, I don't know what has already been drawn on me. You will know what things we standardly order on here because they're listed right here and you can always access it on our website. For those who decide to do the genetic screening that the physician talks to you about, you usually do that after you've hit the 10-week mark. And for those who decide that they're going to do the nuptial translucency ultrasound, that's between 12 and 14 weeks. Then at this point in pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your initial confirmation, you're back in the office to do your OB physical. So the OB physical includes cervical culture screening to round out the standard prenatal blood work. The Pap test is not actually part of your standard prenatal screening, but many times if people are due for one, they'll say, well, if you're going to check cervical cultures, go ahead and press the reset button on my Pap too. But it is not required to have the Pap part done during pregnancy. Those of you who have high-risk issues and need to see the high-risk doctors during pregnancy, they will typically start to see you around week 11 or 12, and that referral is usually sent when you do your history visit with one of the physicians. So about 4 weeks later, you're coming back, and you should be kind of mid-second trimester, maybe starting to feel a few flutters a little bit, and you'll talk about regular round ligament, other second trimester changes. Then about 4 weeks later, it gets us close to the anatomy ultrasound. So remember we said around 20 weeks is when we do that. Now, if your anxiety is not going to let you wait 2 business days to find out what is on your anatomy ultrasound, please be sure that you have a visit with one of the midwives on the same day. The sonographers can print out a preliminary report to give to the midwife and she can tell you everything looks fine. You'll get, the full detail later on. If you're meeting with a midwife around this time, she's going to start talking to you about childbirth education and or breastfeeding classes, which I'm going to give you a little bit more info on that in a bit too. 4 weeks after this is where we're looking at doing the glucose test. I know I'm going to have lots of questions about that, so just hang on to them because we will go in depth on that as well. My mom's whose blood type is Rh negative, which is something that we found out with your original prenatal labs. We want to make sure that we have special medication to give you around 28 to 30 weeks to protect future babies. Around this time, we're going to give you the information to pre-register at the hospital. Those of you who are with us before at Ascension, remember it was paperwork you filled out and mailed into the abyss. Now everything is online. You just fill out everything online and submit it that way so you get a confirmation. If you haven't toured the facility, we encourage you to do that. And if you plan to work with a doula, which we'll also talk about a little later, you want to start locking her in toward the beginning of that third trimester. After this point, we start seeing you every 2 weeks. And so you have an option to repeat or decline your standard prenatal labs. Different populations have different stratified risks for contracting STIs during pregnancy. If you feel you are low risk, there is an option to decline repeating those labs. This is around the time for the early third trimester when if you plan to get any immunizations to be able to pass immunity for babies for certain things, this is the optimal time to do it, and the midwives will discuss that with you. We don't do them here in the office, but we can talk to you about the recommendations are and tell you where you can go and get them. First time moms, you want to pick your pediatrician. If you already know who your pediatrician is going to be, then let them know there's another one on the way. If you're going to be switching pediatricians, veteran moms, this is when you want to start looking for them as well. So the every 2 week appointments continue until about 36 weeks. So moms who are developing any complications with their pregnancy, like high blood sugars or high blood pressures, this is when they're going to start doing their antenatal testing. And then those who already know that for whatever reason they are expecting to have a belly birth, which is our term for a C-section, we want to get that date for you by the time you're 32 or 33 weeks so that we can start to clear Vanessa's schedule so that she can be there with you and your physician for that. So the every 2 week visits go until about 36 weeks when we do another pelvic exam for group beta strep. If you've already opted out of repeating your STI screening, you can always opt out of repeating your cervical cultures. And then it gets real. We start seeing you every week until you deliver. So if you have a birth plan or birth preferences, which we'll go into in a bit, you're going to bring it in and we'll talk about it. Start your natural cervical ripening methods. My belly birth moms are typically all delivered by 39 weeks. So there are certain special circumstances in which you have to deliver at 37 or 38, but usually 39 is the cutoff there. 40 weeks is your due date. And so if you go past that, we'll start your post due date testing, and you must be patient. And everyone needs to have all passengers out of the car by 42 weeks. So for first-time moms, because the average length of your labor is 24 hours when you start it yourself, if we're starting it, we like to have you get started on your induction at 41 weeks and 5 days because we could be looking at a 48-hour process. For second-time moms, 41 weeks and 6 days because your labor is usually about half as long as a first-time mom. All right, so let's go back. Next, pregnancy-safe medications. I have a poll. If you have a headache, are you more likely to take a Tylenol, do a meditation, or go to the emergency room? Polls will be closing in 5, 4, 3, 2, 1. I always love that nobody ever picks go to the emergency room. Fantastic. I'm glad y'all don't have headaches that are that bad. But this week we have more meditators than medicators. And I'm probably more of a medicator for myself. But many of you have been concerned because you say, I'm pregnant. I know I can't take anything. So I've just been suffering with this, fill in the blank here, insomnia, fatigue, congestion, constipation. Not true. Here is a list of common pregnancy discomforts, a list of relief measures that we would want you to try first before you try any medication, and then finally what medications are safe and some caveats about things we want you to avoid. So constipation is a big one, a very sexy side effect of pregnancy that no one ever really talks about. But if you send a message saying, hey, Dr. A, it's been 5 days since I've gone to the bathroom, first thing I'm going to say is, have you tried everything on the website? I'm going to send you a link to this. And some of y'all are getting smart now. You're sending me messages saying, I've tried everything on the website, Dr. Adams. I'm still having this problem. All right, but this is 2 pages of things that you can try. And the things I just want to highlight a little, if you're having nausea, vomiting, you can't keep anything down, including fluids, for 24 hours. Please don't keep trying the things on here. You need IV fluids, so we need to bring you in for that. But just take a look at this and remember that you can download it, you can print it out if you're old school, put it on the refrigerator, because I promise it's always 3 in the morning when you need that stuff. The next box here is about gestational diabetes screening. I'm not going to go through all of this today. I just want you to remember that when it's time to take your glucose test, the information for your instructions on when to stop eating, what you can eat before it, all that stuff is on here on the website. The next one that we will highlight is weight gain in pregnancy, because some of you are very concerned that you haven't gained any weight. I'm already 13 weeks. I'm a third of the way through the pregnancy and I've gained no weight. Don't freak out. Your recommended pregnancy weight gain is based on what your weight was at the beginning of pregnancy. So there's a link here that you can click on and fill in your height and weight, and it'll tell you what your pre-pregnancy body mass index is. And if you're underweight, it tells you what you can gain, normal weight, all that good stuff. But over here is what I want to emphasize. Your rates of weight gain are in your second and third trimester. Your first trimester, everybody's nauseous. Nobody has an appetite. Nothing tastes good. It's survival mode. Or you're craving carbs. All your baby wants you to eat is crackers and cheese and a bunch of like cereal and cookies. And that is what babies will choose if you let them pick their own diet. Second trimester is when you start doing some parenting and you tell this baby, we're going to eat some fruits and vegetables and things like that. So this is your rate of weight gain per week in second and third trimester. Don't worry, your appetite will come back if you don't feel like eating anything right now. All right, birth preferences, we'll click on here because this is our template for a birth plan. These are things that we saw kind of over the years, and people just we just put it all together. So it's all in one place. You don't have to go searching every place to find what you're looking for. For first-time moms, a lot of this can seem really overwhelming because I don't know what I don't know. But there are things on here, everything from how you want labor to start, what do you want to wear in the hospital? Like, I don't care if you don't wear the hospital gown. There's nothing dangerous about that. Everything on here is a matter of preference and opinion. Pain relief, things I want to highlight is that obviously it's a hospital, so we have epidurals and we have IV pain meds, but there's also hydrotherapy. So we do have blow up tubs that you can take home after you use them because we don't need them again. But hydrotherapy is an option. The nitrous oxide is in the building. We are still awaiting a policy from the hospital for it. So hopefully by the time you guys deliver, that will actually be an option for you as well. Things I think just to point out is that, we don't starve you and we don't strap you to the bed. Like, we want you to get up and move around. We want you to be an active participant in labor as well as your baby. Obviously, barring any things that are dangerous about you getting up and walking around. If your blood pressure is very scary every time you get out of bed, then we're not going to, sacrifice possibly giving you a stroke just so you can move around. We'll figure out ways to do it when you're in the bed because we still want movement, active movement of the baby. Our usual thing is warm compresses, slow delivery of the head, trying to avoid tearing. If you have a certain mineral oil or essential oil that you want used during your delivery, we're fine with that. Otherwise, I think we just have mineral, and some of the doulas bring frankincense. You can deliver in any position, push in any position. We usually do delayed cord clamping, immediate skin to skin. You can decide what you want to do with your placenta. This is a list of medications that are offered to the newborn. You have a chance to come in and ask the midwives, what's the evidence on this? What is this used for? Does this apply to me? Circumcision, if you're having a little boy, you decide you want to have him circumcised. We should be asking that during your prenatal visits too, but we'll definitely ask after you deliver. And then Naisha will get in touch with you about his appointment, financial arrangements, all that good stuff. And breastfeeding, all the nurses are trained in basic latch. If I have twin mamas on here, we do have some twin choices as well. And then belly birth, we do gentle cesareans here, which is a family-centered belly birth. It is less like a procedure and more like a birth because that's what it is. All right, cervical ripening techniques. So at the end of pregnancy, when you're trying to figure out ways to help your body be ready to go into labor, again, these things do not put you into labor. Your baby puts you into labor. Baby gives the signal, and it's just whether or not your body is ready to respond. There are things you can be doing to prep your body, your uterus, and your cervix specifically to be ready for baby signal. So, raspberry leaf tea at 20 weeks, and then everything else kind of happens closer to full term. Full term is 37 weeks, and your due date is 40 weeks. So, the week before your full term, these are things that you can start doing to help to get your body ready for when baby says it's time. Now, what you will not see on here is castor oil. And if you're wondering why, definitely pose that question to one of the midwives. All right, so I have another poll question. So I'd like to know how many moms are on the call who have had a previous C-section and are planning for a vaginal birth after cesarean. So all the first time moms, you're already not, it's not you. I already got you. All right, polls are closing in 3, 2, 1. Okay, cool. We have quite a few. Now, first time moms, that doesn't mean that I don't want you to pay attention to this because you are in the same struggle as the previous C-section moms. So these are recommendations for first time moms and moms with previous C-sections seeking vaginal deliveries because you're both just trying to avoid a C-section. Um, Seeking a Webster certified chiropractor, doing your pregnancy yoga or Pilates. Many of you know that I'm a VBAC mom. Dr. Merrill delivered VBACs for me, my two VBACs, and I delivered hers as well. Midwife Lauren is also a VBAC mom too. And these are some things that we did on our VBAC journey. Getting an experienced doula. Do not cheap out on the doula at this point. Only gaining the recommended amount of weight during pregnancy. Going to spinning babies if baby's position is an issue, not being breech, but being head down with the head crooked or so. That's the most common reason that we do C-sections, not because the baby is too big or in distress, but because the baby is just crooked and won't descend into the pelvis the right way. So remember that all these things are out here. First time moms, please hear me. This is your best way to control what you can. Babies are going to baby, but if you know you've done everything you can to avoid an unnecessary C-section, then you can feel good about whatever your baby decides is your fate. And then lastly, circumcision care. Remember, if you have a little guy, we don't do the circumcisions in the hospital. We do them here in the office, preferably before he is 10 days of age. All right, so any questions about anything that's on the website? And if not, then we will head back to our presentation. Okay, are you able to see my presentation again? Can everybody see the Starbucks stuff? Okay, cool. All right, so those who are concerned that they are gaining too much weight and saying, Dr. Adams, I don't know what's happening. I'm just drinking coffee and gaining all this weight. Now, are you drinking coffee, girl, or are you having salted caramel mocha monstrosities every morning with 600 calories of fat and sugar? It's one of my favorite drinks that I can not have very often. Did you know that pregnancy only requires an additional 300 calories per day? It takes 10 calories to maintain a pound of body weight, and your pregnancy goal weight is based on what your starting body mass index was, that chart that we looked at before. So let's say we start the pregnancy at 170 pounds. It takes 1,700 net calories to maintain that. So if your goal weight gain is 25 pounds, 250 calories is what you're going to be adding on as a net, which equals 1,950. Divide that between breakfast, lunch, and dinner. That's 650 calories per meal. You cannot eat 650 calories and then wash it down with a 570 calorie mocha monstrosity. So this is a busy but good slide because you say, oh, okay, calories, yes, but how am I dividing these calories up? So this tells you carbohydrates and proteins and fats, like how much you want to, what you want to limit and things that you want to have in higher quantities. Over here on the right, you'll see just some small changes that you can make to make a big impact. Going from traditional spaghetti sauce to a 20-minute herb-infused marinara drops 500 milligrams of sodium and can keep your rings fitting for the rest of your pregnancy, because that's the most common thing. Dr. Adams, I can't get my rings off because your fingers are swollen. The first thing I always ask is, what'd you eat last night? Chinese food? I have a question out here. Can I bring my daughters to my appointment? Yes, absolutely. We love kids. Based on what we do, we love them. All right. Fruits and veggies, whole grain, cereal, go for it. You will not give your baby a nut or dairy allergy by eating those things. For my coffee drinkers, you want to keep your caffeine to less than 200 milligrams daily. Keep in mind, caffeine is a diuretic, so use the 3-to-1 rule. For every amount of caffeinated beverage or food, please take in 3 times as much water to keep yourself hydrated. Herbal teas are fine. These are our favorites in pregnancy: raspberry leaf, ginger, lemon, and peppermint. And for my vegetarians, my pescatarians, you want to make sure that your protein stays around 70 grams daily. There are some pregnancy diets that are telling you to eat 120 grams of protein. Please don't do that. Everybody who does that has like an 11-pound baby, and just please don't. So 70 grams is plenty for you to grow a normal, healthy human-sized child. Deli meat is fine as long as you are microwaving it for 30 seconds. You do not have to be piping hot and burn your mouth, but you want to be sure you kill any harmful bacteria in 30 seconds will do that. If you're eating soft cheeses, be sure they are made with pasteurized milk. If you're at a restaurant and can't tell whether it's made with pasteurized milk, maybe you skip the brie for the evening. But if you're at Trader Joe's and you want to just flip it over and see if it's pasteurized milk, you're good. Canned tuna, you can eat 3 of those 4-ounce cans per week. If you are a pescatarian or you just love fish a lot and need to eat more fish than that, the FDA has a really nice document, even though this says October 21, they have not updated it, still current information there about fish that you should eat in large quantities because it has DHA, which helps with baby's brain development, things you should eat in moderation because it's kind of neutral, and things you should avoid because of high methylmercury content. You want to also avoid undercooked meats and fish. So if you are a foodie like me and you like your medium steaks, for the next 6 months, you will have to ruin your food and cook it all the way through. That yummy ahi tuna, sorry, that's also a no-go. For my kombucha drinkers and my kimchi eaters, those are fermented foods and beverages. So you want to limit your intake there. Same with alcohol being fermented as well. There's no amount of alcohol that we can say is safe in pregnancy. So our general message is to just avoid it. And you want to limit your sodium to less than 1,500 milligrams per day. If you think back to how much you can change by just going to herb infused marinara, think again that 1,500 milligrams is for your whole day, breakfast, lunch, and dinner. You'll be appalled if you start turning your food over and seeing what's on it. So any questions about food before we move to exercise? All right, I must be answering all your questions before you ask them. All right, it is fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. You just won't feel like it in your first trimester, and that's okay. Second trimester, there will be some physiologic changes. You'll increase your blood volume by 50%. It'll accommodate more aerobic activity. So just listen to your body. If you weren't doing anything before, no judgment, a little judgment. It's okay to start a new regimen because, as I mentioned, sedentary lifestyle leads to malposition babies, which is our most common reason for belly births. Resting heart rate, those of you with these little Fitbit watches that are constantly monitoring what your heart rate is, you will notice your resting heart rate rises about 10 to 20 beats per minute, like at rest, you're not doing anything. That is normal. That is a physiologic change of pregnancy. Unless you're getting dizzy and passing out with it, don't worry about it at all. Those of you who say that you have been walking and that is your exercise, sort of. Walking is considered aerobic exercise if your heart rate is in the aerobic zone, which is 70% of your maximum heart rate. Your max heart rate is 220 minus your age. So if you're 30 years old, you start with 220, subtract 30. You should not be exercising for prolonged periods of time with your heart rate above 190. 70% of 190 though is 133. So that's where your aerobic zone begins. So your goal is to exercise with your heart rate between 133 and 190 for 30 minutes, 3 times a week. If when you are walking, that's where your heart rate is, then your walking is exercise. If when you are walking, your heart rate is still hanging out between 80 and 100, then that is transportation. And transportation is fine, but we have to also find a way to get aerobic exercise, such as cardio. Want to do the treadmill? Go for it. Elliptical is fine. Running is fantastic. Swimming, find yourself a heated pool that's not frozen over today. Indoor bike, if you're on a Peloton, my name is Off My Meds 8, and I ride with some patients sometimes. Weightlifting, it's fine to ride. It's fine to lift up to your pre-pregnancy level. You don't need to increase your resistance during pregnancy because your baby and your body will do that. Squats are my favorite. So you want to build up to a minimum of 50 squats per day. If you're already experienced squatting, you're doing more than 50 per day, go for it. If you haven't been squatting before, at 20 weeks, I want you to start by giving me 5 a day. 21 weeks, you're giving me 10 a day. 22 weeks, you're giving me 15. Build up to a minimum of 50. And they don't have to all be at the same time. You can do them throughout the day, which is actually probably a little better. Pilates and yoga are also two of my favorites. Anything that makes that pelvis open up and get those muscles long and lean. Any experienced instructor will be able to tell you what the pregnancy modifications are. What you want to avoid, though, is high intensity interval workouts after first trimester. It's not the interval, it's the intensity. You can do the low impact versions of these, but just nothing with the sudden jerking movements because we don't want to shear the placenta off of the side of the uterus. Nothing that has you lying flat on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs, but not lying on your back abs all the time. Hot yoga, if you're a hot yoga instructor and are fully acclimated to that environment, then you're fine. If you are not, perhaps we do not try hot yoga because you'll get dizzy and possibly fall on your belly. Scuba is a no because of decreased barometric pressure, decreasing oxygen to the baby. Same thing with high altitude hiking. If you are visiting family or what have you in Colorado, 8 to 10,000 feet is where we like for you to hang out, but just don't go hiking with them at that level. Please don't take up contact sports. This is not the time for kickboxing. We've also had some pickleball incidents. So anything with a ball flying at your belly, maybe you want to avoid. And outdoor biking after 16 weeks isn't a no. It's just to be careful because your center of gravity starts to change around 16 weeks. And as you start to turn and try to make some of those corners, you may find yourself tipping over more often than not. All right. So next we have another poll. And our next poll question is about nutrition and exercise. Now that we've talked about them, can you prevent gestational diabetes with diet and exercise? And the polls will be closing in 5, 4, 3, 2, 1. All right. Not as many veteran moms as I have before, but I think my veteran moms are the ones who know me so well and know that the answer is no. You cannot prevent it. You can manage it with diet and exercise, but you cannot prevent gestational diabetes with diet and exercise. This is the reason why we screen everyone for gestational diabetes, because your number one risk factor is your placenta. You know how we blame our hormones for like everything? Gestational diabetes is all about your hormones. That's it. Your placenta gives off hormones that tell your insulin not to do its job. Insulin has the job of clearing your bloodstream of glucose. If insulin is not doing its job, then you have all this extra glucose just circulating around in your bloodstream, causing trouble. That is what diabetes is, extra glucose in your bloodstream. But it's because your placenta told your insulin not to do its job. So it's nothing to do with you or your family history. It's not a judgment on your lifestyle. It is because you have a placenta that is giving off hormones that is not allowing you to process your glucose. I have a question here. If you already have diabetes, will you still receive the glucose test? Absolutely not. Absolutely not. You already know it, and so we'll be treating you accordingly. So please do not take that test. For my moms who say, but I never eat anything with sugar in it, Dr. A. You eat good carbs, so don't avoid your good carbs prior to the test. Eat your normal servings of fruits and whole grains and things like that. If it is the drink itself that bothers you, we have alternatives. So the Simply Pure drink is sold here in the office. It is soy-free, it is dye-free, it is gluten-free, it is BBO-free, kosher, and vegan. It is offensive to almost no one. It's just glucose. There are additional patient-driven options on the website. So remember that little sheet that I clicked on quickly? There are some links there for the fresh test, glucoorganics, and glucose tablets. And those are all options. So if you're planning to use one of the alternatives, please let your midwife know when it's time for her to order it. And then because Quest 1 doesn't take outside glucose sources, so we have to send you to LabCorp for it. And 2, there are instructions like don't drink it before you go there, that sort of thing. And so they need to write on your lab slip patient to bring outside glucose source. So just let us know so we can help you. Preparing for birth, we talked about childbirth education classes. Here are a few that are offered throughout the city. So there's hypnobirthing, there's hypnobabies, there's Bradley method, there's Lamaze. So this is just a starting point for informational purposes. We know the people who teach all of these, but there are others out there whom we know as well. So we're not endorsing anybody over anyone else. For breastfeeding classes, Sonia is a lactation consultant at HCA, and she's amazing. And so she has breastfeeding classes that roll, so you can hop in on one of them prior to meeting your little one. Every new parent should know CPR. So if you knew it before, you need a refresher. There's a link to the Red Cross. Some of the classes are virtual too. A nice refresher. If you're already seeing a chiropractor, fantastic. If you're not, make sure that he or she or they are chiropractor are Webster certified, which is a special pregnancy certification, so that they are not making adjustments that are harmful to the way that your body naturally develops during pregnancy. Okay, now who is planning to work with a doula? There's a poll question out there on the floor. Some of you, I think, already knew who your doula was going to be. Some of you worked with them in the last pregnancies, and some of you are not sure what a doula is. Polls are closed. All right. Okay. I don't have anybody who says that they are not sure today. I always have someone. Okay. Fantastic. And most of you are planning to. That does my heart so good. So what's a doula? I'll just go through it since you guys seem to already know it. They provide emotional and physical support before, during, and after pregnancy, like helping you remember how to breathe, getting you in different positions that help us to get your baby out, and relaxation strategies so that you're not tensed up and fighting your own body. They're not giving you medical advice or providing medical care. They are helping you process your feelings about the medical advice or medical care that you are receiving from us. So they're not going to write prescriptions and they're not going to deliver your baby. So please definitely tell us when you're headed to the hospital so that they are not left in a position where they're delivering your baby on the side of the road because you didn't make it in time. The best doulas with whom we've worked, and we love working with doulas, we have ever since the practice opened, are the ones who will maybe come to you with a prenatal visit or, do a virtual on the visit, help you make your birth preferences. When you call them for labor, they're coming to the hospital with you. It's not teledoula who shows up when you're 9 centimeters. Talk to the midwives. They have no shortage of recommendations on, or opinions rather, on the doulas with whom we've worked over the years. Acupuncture and acupressure are fine. Pregnancy massage, some places will require a letter. If you need one, we have a standard letter for pregnancy, and we're happy to give that to you as well. Many of your insurances will cover breast pumps. We have a company that will look at your insurance, figure out which ones they cover, send you a list to choose from, write a prescription and send it to us, and then we just fax it off. Please scan our QR codes around 20 weeks. You'll have your breast pump by the time you're 25 weeks. Please don't go finding your own company to do breast pumps because it is a really arduous process with some of the other companies that are out there. This one makes it very, very easy. Question I have is, can I get a prenatal massage during my first trimester? The short answer is that it is safe. The longer answer is a lot of places won't do it during first trimester because of a higher risk of unrelated miscarriage, and they don't want to be associated with that happening. So second and third trimester is going to be your best bet for getting a prenatal massage. Those of you who plan to use the Family Medical Leave Act, you need FMLA paperwork filled out. We are now using a third-party vendor to complete these forms. If you had a baby someplace else or with us, and know those forms can sometimes take 2 weeks to get back. We've been working with Leave Guru now for just under a year. Most forms, I mean, it says less than 24 hours. Sometimes they're done in like 10 minutes. It's awesome. So Tony is your point person for that. Contact us for details. And then postpartum care, because one day that baby will be out and in your arms. For my moms who had any issues with blood pressure during pregnancy, we see you back within a week to check your blood pressure, because preeclampsia, even though pre sounds like prenatal, the most dangerous time for preeclampsia is within the first 14 days after you deliver. So we want you back in the office to make sure that we are moving in the right direction after baby's out. For my belly birth moms, you come in for your incision check at the 2-week mark. Routine mental health screening. So we do screen around 20 weeks, everyone, so right around ultrasound time. But then we screen you again. About 80% of women will have baby blues, which persists for up to 14 days after delivery. If it's going past that, though, then we may be looking at postpartum anxiety, postpartum depression, postpartum rage, and we want to get ahead of those and get you referred to somebody who can help you to work through them. Postpartum doulas are a thing. So if you need mental and physical and emotional support, when do you need it more than when you bring home a new little one? The Motherhood Space is a wonderful program here in Jacksonville, sponsored through Baptist and the YMCA downtown, that provides kind of a play and therapy space for new moms with postpartum anxiety or depression. So if we identify you're a candidate for that, we're happy to make that referral. And then pelvic floor therapy. This typically starts at 8 weeks postpartum. So you come in for your postpartum visit at 6 weeks, do your evaluation, and then we refer you to the nurse who comes here to the office. So it's all under your insurance that's here. And she's here Tuesdays, Wednesdays, and Thursdays and does bio feedback to help re-strengthen those pelvic floor muscles. It helps with incontinence of urine and stool discomfort with intercourse, just really helps a lot with healing altogether. So random frequently asked questions, you can sleep on your left side, your right side, or your back. We just don't want you laboring on your back. That's when we say don't be on your back. So if it bothers you to be on your back, like if it gets you dizzy, buy one of those wedge pillows from Amazon or body pillows. Things are amazing. You can help paint the nursery as long as the room is well ventilated and or you're wearing a mask. You can take probiotics. You can dye your hair, including your eyebrows. You can wear gel nails. If you're going to the salon, though, and you're going to be around a lot of fumes, you might want to wear a mask just to keep from getting dizzy. Car travel up to 37 weeks. Remember, 37 weeks is full term. So after full term, again, your baby doesn't have a calendar and they may just say, I'm ready. And then you're out of town and you're delivering with people who aren't full circle, and nobody wants that. So if you are traveling by car, just be sure you're getting out and stretching every couple of hours. And if you're drinking your water, then your bladder is going to be telling you to do that anyway. For skincare, you can use your salicylic acid, benzoyl peroxide, that sort of thing. Just nothing that has retinol in it. So if you were using retinol before, bakuchiol, Bakuchiol, is a natural alternative found in lots of products that will have some of the same effects of retinol without the harmful qualities. And flight is okay for twins up to 32 weeks, for singletons up to 36 weeks. Beyond that, you may need a note from us. Just be sure you are wearing your compression hoses, drinking lots of water so you have to get up and go to the bathroom and do your toe raises in the seats to keep from getting blood clots in your legs that can go to your lungs. Very dangerous and deadly. No roller coasters, no water slides. I think you guys are part of my summer crew. So those are two things you want to avoid. We have a question here. Is it dangerous to travel in an airplane in your second trimester? Nope, flight is fine up to 32 weeks if you're twins and 36 weeks if you have one little one in there. All right, last thing, guys, is the COVID-19 update. So for vaccinations, ACOG strongly recommends them versus supporting either way based on 35,000 women they studied in April 2021. Moderna and Pfizer, but not Johnson & Johnson because of its independent risk of blood clots. Again, we do not give them here, but if you want to get a booster to be able to grant your baby immunity early third trimester, all vaccines have been approved for boosters. So if you're more than 6 months past your last Moderna or Pfizer, it's a good time to get it. If you're more than 2 months past your Johnson & Johnson, don't get another Johnson & Johnson because of the blood clot risk, but you can mix and match. That's fine. If you're trying to time them against flu vaccines or RSV or Tdap, talk to the midwives because there are specific wait 2 weeks after this one and that sort of thing. If you do get COVID, please do not come to the office. There are no recommendations for ivermectin, but please do not come to the office. There's also not a recommendation for azithromycin, but please do not come to the office. And then finally, we don't prescribe Plaquenil. We just ask that you do not come to the office. Can you tell that I don't want? Yeah. So really any upper respiratory thing, we're dropping like flies today. We had one medical assistant for 4 providers. When we get sick, we can't take care of you. So please don't bring your sickness here because we want to come in and work and take care of you. If you do contract COVID or any other upper respiratory, we recommend converting to virtual appointments. That's the please don't come to the office. Thanks. Vitamin D3, zinc, vitamin C, and if it is COVID specifically, we recommend a low dose aspirin, the 81 milligram, like little baby chewable bear things for up to 36 weeks. If you get COVID after 36 weeks, don't start the baby aspirin because you may increase your risk of bleeding around delivery. And then we recommend serial growth ultrasounds because COVID has been linked to gestational hypertension. and hypertensive disorders. And so we want to make sure that baby's still getting as much blood supply and nutrients as he or she needs. We just recommend supporting therapy at home. Remember, the website has information on cough, cold, congestion, sore throat, fever, all that good stuff. You really only need to go to the hospital if you're having trouble breathing or you have a fever over 101 that you can't break down. For those of you who had babies between 2020 and 2022 and are freaked out about being by yourself, take a deep breath. We are back to having 4 visitors in the labor room, plus your DONA certified doula. She does not count as one of your visitors. She's part of the birth team. We don't require masks in the room or labor unless you actively have COVID or flu A while you are in the hospital. And if you have either of those things, we're still not separating you from your baby. The question that I have here is, should family members also be vaccinated if they're with the baby in early months? Yes, they should have the Tdap. And if they are older, then the RSV vaccination, and the midwives can answer specifically which ones apply to you. All right. Last poll question. Y'all were not the most talkative group today, but I think hopefully I answered all of your questions. The last question here is, what information can you find on our website? The birth preferences, your safe medications, what to expect at each visit, or are you a stellar test taker and you know you have to read all the way to the end and find the all of the above? All right. Polls are closing in 3, 2, 1. Thank you guys so much. If there are questions that I did not answer, now is the time to go ahead and ask them while I'm reminding you that we are social. I'll be honest, we haven't been very social recently, but we are on all of these things. So please feel free to follow us. Occasionally, we'll collaborate on some doula posts and we'll see some of your rock star birth stories, the in her words situations, and put those out there because some of you are here because somebody told you about their awesome birth. And so what we want is to hear your amazing warrior birth story and let other people know that they can do it too. Questions I have, are compression socks the same as compression hose? Yes, just make sure they're at least up to your knee. Great question. Great question. All right. Well, if there are no other questions, you guys have been awesome today. And I will look forward to seeing you at a prenatal visit very soon. Oh, good info. Thank you. Can't wait to deliver with you. I know it's going to be amazing. So thank you for choosing Full Circle, y'all. I know that there are like so many GYN offices in town and you could have gone anywhere, but we do not take it lightly that you chose us. And we can't wait to be a part of your amazing birth story. So thank you again and have a wonderful evening. Bye-bye.